Welcome to our training on VSee video telehealth from a provider's perspective. Our patient service center will still place patients on the schedule should they decline a telehealth visit. The provider will make the decision at the time of pre-screening if the patient is well enough to come inside the clinic, or if the patient is high risk or symptomatic, if a curbside visit is more appropriate. This video will show the patient portion of the visit. First, log in from Google Chrome. Make certain to use the provider login URL for VSee and save as a favorite. Log in with your provider credentials and make certain to turn off your notifications to avoid chime interruptions. Next, you will open the patient's chart in Centricity. You will then return to your VSee application, find the patient in the waiting room. You can use Control F to search, and always make sure to identify with 2 patient identifiers at the start of the call. Start with an introduction and ask the patient if they can see and hear you well.
Hi, Luke Skywalker. This is Tracy from Sound Family Medicine. Can you hear and see me okay?
I can.
Awesome. Thank you. And just for HIPAA purposes, can you verify your full name and date of birth?
Yes. Luke Skywalker, May 21st, 1977.
Great. Thank you so much. And I understand we're seeing you for cough and fever today, correct?
Yes.
Next, you will obtain consent using .vv consent quick text. You will then read the disclaimer to the patient. Should your patient decline, have a team member reschedule an in-office or curbside visit.
And Kevin, just to make sure that I have your permission, I want you to understand that we're conducting this visit today by virtual health, that there's an option for an inpatient encounter, and that I have your permission to proceed.
Yes.
Great. Thank you so much.
Make certain to note the visit start time and end time within the body of your chart note. If your chart has not already been prepped, determine the reason for visit and select the appropriate C-Quick form.
So, Kevin, can you tell me about your fever?
Yeah, it started last night. It's had a temp over 100, 100.4, 100.5.
Hey, sorry, go ahead.
And it's persisted through this morning. So,
It seemed like it came on pretty suddenly.
yeah.
Hey, have you had any close contact with a laboratory confirmed COVID-19 patient in the last couple weeks?
Not that I know of.
Have you traveled to China, Iran, South Korea, Italy, or Japan?
Nope.
Okay. So things started last night pretty suddenly. Can you describe your cough for me?
Yeah, it's just kind of tickle in my throat. It's comes on throughout the day. Surprised it's not happening right now, but yeah.
Okay. Any ear pain, sore throat, runny nose?
It's a little runny nose, but other than that, no.
Have you had chills?
Not yet, no.
Sweats?
A little bit.
And do you feel like you're having any difficulty breathing or wheezing?
Just when I'm coughing Nothing. No.
And does that cough happen any time of day? Or is there a
Yeah.
time of day where it seems like it's more present?
Probably more in the evening.
Do you have any history of allergies, like seasonal allergies?
Sand.
That's a new one. And are you coughing anything up? You said it was dry.
Yeah, it's just right.
And Kevin, do you have anything available like an Apple Watch or a Fitbit, something that would tell us your heart rate?
Yeah, I've got an Apple Watch.
Great. Can you tell me the number that it says for your heart rate?
Sure. So, it's measuring it right now. The last 3 minutes ago it was at 64. I'm down at 64. 101.
That's a big jump from a couple minutes ago.
Yeah.
Great. And do you know a recent weight?
Sorry, say that again.
Do you have a recent weight?
Yeah. 215, 220.
Okay. And do you have your thermometer handy?
It's in the other room. You want me to grab it?
Oh, yeah, that'd be great.
All right.
Now, did you go to work with a fever?
No, why would I do that? Secluded myself. All right. Here we go.
And then just read me what number it says after you do that.
All right. This says 96.8.
Oh, good. Your fever's gone down.
Good.
Great. And you're not a smoker, right?
No.
Did you ever smoke?
Nope.
Okay.
That was my dad. And
And do you vape or chew tobacco?
nope.
Sorry, it turns out we got some software updates in the middle of this whole coronavirus thing, and so it's asking me some additional questions.
Oh, okay.
So Kevin, based on what you're describing to me, you do have some symptoms of coronavirus, but it sounds like you're pretty low risk right now. So I want you to make sure that you stay home except to receive medical care. Honey, tea, lemon, and warm humidified fluids may help you with your cough. Make sure you separate yourself from other people in your home and that you stay home until you've been symptom-free for 3 days. If you start developing a worsening fever or cough, I want you to give us a call back. And if you develop severe shortness of breath, I want you to go to the emergency room.
That's good.
Do you have any questions for me about our visit today?
It's pretty clear.
Great. Thank you so much, Kevin.
Thank you.
Bye.
Bye.
Throughout your visit, make sure you're documenting your review of systems. Provide information that will allow us to better understand what the patient was experiencing. Examples are
Fever, sweats, chills, cough, congestion, earache, chest pains, cough, wheezing, or trouble breathing.
You can also include information such as patient speaking in full sentences or gasping throughout the visit or conversation.
In this case, we documented that the patient was well-sounding, speaking in full sentences with no evidence of respiratory distress or cough heard during encounter. He also was awake and alert with an intact mental status and seems to have good judgment.
Make certain to document the patient was given callback instructions and home care guidance. Again, make certain that you've documented the start time and the end time of the call. Document your medical decision making, enter in the appropriate coding, such as 99213, and then make sure to sign your chart note. Thank you. Have a great day.